My name is Chip. Home is in the Tri-Cities, Washington, and I've lived there since 1986, and it is home. I like it. When it came time for getting the implant and getting the surgery, I came to Swedish in Seattle, and I'm very satisfied that I did. I am a fixer. I enjoy people bringing things to me that are broken, whether they be kids' toys, whether they be household appliances. I get a lot of enjoyment out of taking things apart and hopefully putting them back together in such a way that they work. I've chosen to be a spokesperson for the procedure, first because a lot of men aren't even aware of the option of getting a penile implant. They have no idea that it's out there, and they have a lot of questions about it, and they want to ask somebody. They would like answers to their questions, but they want somebody who is, to them, credible. I generally am found credible with these men because I have one. In 2005, and I was diagnosed with prostate cancer, and that I had treated locally there in the Tri-Cities. And it was treated by brachytherapy, which is the radioactive seeds. That worked out fine. Seeds destroyed the cancer. And it turned out over maybe the next 6 to 8 months, the radiation also ruined my ability to achieve an erection. And we tried, we meaning with the local urologist that I was dealing with, tried the Viagra and several of the other products, the vacuum pump product and things like that. They worked, kind of, didn't like the side effects, and I was looking for alternatives. And that's when I came upon the idea of the implant, penile implant. And I got very interested in that. That was about 2009. Unfortunately, at that time, I was diagnosed with non-Hodgkin's lymphoma. That took priority. That took several years to get beyond, but finally, after lots of drugs and transplants, stem cell transplants, that was behind me. And I went back to the question of quality of life. How do I get back that ability to achieve an erection? Fortunately, I didn't have any incontinence issues, but the erection, the quality of life issue was certainly important. I talked to my oncologist, I talked to my primary care, I talked with a local urologist, and all three said the same thing. You look to me to be a great candidate for it. Go to Swedish in Seattle. All three said to do that. So I made the phone call, got hooked up with Swedish, and everything worked out great. I feel like I got everything back again. It's no longer something that bothers me, that loss. So life is good. I think of it as outside the bedroom and inside the bedroom. Any activities outside the bedroom that a person has done, that I did, you can do again. You want to ride a bike? Fine, not a problem. Ride a horse, go play sports in the park, whatever you do, whatever you had been doing, you can still do. Go to the gym. Nobody there's going to notice when you take your shower that you had an implant. So it's back to life the way it was when you were much younger and things were functioning. That's outside the bedroom. Inside the bedroom, well, I can't say that I've tried everything or know everything that goes on inside a bedroom, but I'm confident that whatever an individual or a couple were doing in the privacy of their own home, they can do it with the implant. If you're thinking about the penile implant as an option, my advice is, unless you can't do it, it's worth it. It's worth going through the procedure and the process. It's worth getting that portion of your life back as a quality of life issue. So the first thing, if your issue is due to, say, cancer, yes, get the cancer treated. But know that impotence and incontinence can be treated afterwards. And the penile implant device works.